The way it manifests is their frustration at inability to lose weight. So I see adolescents and young women in particular who train, exercise impressively, and honestly are generally not eating that much, eating sensibly if you like, but they only have to look at food and put on weight. Hi, I'm Soji Swaraj. I'm a specialist physician. I'm an endocrinologist. So we deal with hormonal issues, diabetes, thyroid, metabolic syndrome, PCOS, fertility. So I consult here at East Sydney Private as well as the Integrated Health Institute in George Street. So metabolic syndrome is this constellation of issues surrounding a central chubbiness. So central fat mass associated with high blood pressure, high cholesterol, a tendency to cardiovascular disease, as well as diabetes and various cancers and other diseases such as arthritis and sleep apnea. So the physiological basis for metabolic syndrome is based around insulin resistance. Insulin being a hormone that comes from our pancreas, which we release into the bloodstream continuously, but also in response to food. And insulin does lots of things, but one thing it does is it drives glucose into the cells. If you've inherited a level of insulin resistance, it means at the receptor level on each cell, your insulin is not working as efficiently as it might in other people. And to compensate for that failure, your pancreas releases more insulin, and so you might be carrying more insulin in the blood compared to the next person, and even higher after some meals. And the side effect of that insulin is that insulin tends to help you store fat. It makes it very easy to store fat. And once you put on fat tissue, the fat secretes hormones that make you more insulin resistant. So it's a vicious cycle. We shouldn't confuse the two terms, metabolic syndrome and insulin resistance. Insulin resistance is the pathophysiological cause of metabolic syndrome, that tendency to high insulin levels, which contribute to your weight gain, and then the vicious cycle of the fat gain contributing to the insulin resistance. So the risk factors and causes for insulin resistance and metabolic syndrome. Well, first of all, insulin resistance is hereditary to some extent. If you're fortunate enough to be born in a relatively slim, active family, well, then you may also be the same. But if mum or dad are chubby, or they have insulin or have diabetes, then you may be a higher risk of inheriting that from them. But you're also likely going to inherit a lifestyle from them as well, food choices, exercise choices. So clearly the number one risk factor for all of us is what we call an obesogenic environment. We seek and desire occupations which are highly paid, paying us to sit still in front of a computer or a desk to earn lots of money. The opposite of what our ancestors were doing, which is physical bending, lifting and carrying and digging on the farm. The way it manifests is their frustration at inability to lose weight. So I see adolescents and young women in particular who train, exercise impressively, and honestly are generally not eating that much, eating sensibly if you like, but they only have to look at food and put on weight. That's typical of insulin resistance. When you examine these women and men as well, and look at the back of the neck, you'll often find dark patches in the skin creases, which their mums think is dirt, so they're scrubbing their necks, but it's actually not dirt, it's called acanthosis, and that's a direct mark of insulin resistance. Dark patches under the eyes and the skin creases or under the armpits, or skin tags on the neck. So they're all typical signs of insulin resistance. But of course we know insulin resistance also causes high blood pressure, contributes to your abnormal cholesterol profile as well. The starting point of metabolic syndrome management in our clinic, and certainly in mine, is to understand it. It's not energy in, energy out. These people often are hardly eating anything, so if you often explain that to them, that's the starting point. The second thing is to give them a strategy that's doable for them, which is to decrease their seated hours. Count their number of hours seated and decrease it. Increase their step count. In my practice, I add some farm work. So if you haven't got a farm to work on, I simulate the farm work with 20 reps of resistance exercise 6 times a day, simply to release these hormones from your muscles. They're called myocytokines, which lower your insulin resistance, which improve it. So resistance exercise addresses insulin resistance. And of course, an aerobic dose, which could be 10,000 steps or a Zumba class. And on top of that, we layer a food strategy to lower the insulin. So shifting towards more vegetable varieties as for your carbohydrate source, and less carbohydrates from cereals, which in my practice I notice seem to preferentially spike your insulin.